Hi, hello everyone. This is Vamshi Krishna. Today we will see some of the basic questions for upcoming staff nurse recruitment examinations. So we all know that in the Telangana we are going to apply for the staff nurse examination, that is recruitment. From the yesterday onwards, the applications also the started, and the last date for application February 15th. So I hope you don't miss the application, and I thought you will prepare for the examinations very well. So let's enter into the topic. The first question is, uterine pacemaker is situated at. So in the uterus, so if you think it is a uterus, this is cervix, this is fallopian tubes. So what do you think where the pacemaker will be present in the uterus? So we all know that the pacemaker will be present in the heart. What is the function of pacemaker? It will generate the electrical impulses towards the myocardium of the heart to contract the myocardium of the heart. So in the same way, in the uterus also, the contractions will be taking place by the uterine pacemaker. So where it will be located? The options are isthmus, cervix, uterine body, and cornu of the uterus. So the right option is cornu of the uterus. So cornu of the uterus will be present at the fundal area. Okay, if you think it is a uterus, so in this area, the cornu of the this area is called the cornu of the uterus. So here we will have the pacemaker. So which produce the and which generate the electrical impulses for the contraction of the uterine uterine wall. So uterine contractions generally begin at the top of the uterine fundus. Okay, so uterine fundus is this area will be present at the top of the uterus and spread down towards the cervix. So from the up to the impulses will coming down from the fundus to cervix. So, uterine contractions during the final trimester increases the strength and uterine muscles called Brixton-Hicks contractions. So, Brixton-Hicks contractions are nothing but contractions uh, which are made for the expulsion of the fetus and placenta. These are slow rhythmic contractions of the uterine myometrium. Myometrium is the muscular layer of the uterus. Okay, here the Bruxton Hicks contractions made by the uh, uh, pacemaker of the uterus. So the next question is, autonomy versus shame and doubt is which stage of growth and development according to Erickson? So in the pediatric subject, we all read the growth and development theories. So among those, Erickson also developed a theory. So according to the Erickson, what stage of autonomy versus shame and doubt? The options are toddler, preschooler, adult, adolescence. So which stage people will face the autonomy versus shame and doubt? The correct option is toddler. So in the stage of toddler, the children will have the autonomy and shame and doubt. Autonomy nothing but they want to do something, but they will fear for something. So they will have the autonomy nothing but its ability to do some kind of a small works. So the next question is, the epidemiology tried is a. So what is the epidemiological tried? So the options are agent, host, environment, host, agent, mode of transmission, agent, host, mode of transmission, and agent, incubation, host. So which is the right answer for epidemiology tried? The correct option is agent, host, environment. So in the epidemiological triad, commonly we will see the So in the epidemiology, commonly we will see agent, host, agent, and environment. So this epidemiological trait will describe the a disease transmission and a development. So for example, if you think a host are nothing but age, sex, race, and all the factors related to the human being. Okay, marital status and family background. The person who will affected by the infection, that person will come under the host. So the next one is the environment. So in the environment, the person what type of temperature is having, and the humidity, attitude, crowding, housing, neighborhood, water, milk, food, radiation, pollution, and noise. So these are the environmental factors which are influence for the affecting of infection. And the next one is the agent. Agents are nothing but the viruses and the bacteria which produce the pathogenesis. Okay, those are biological nothing but bacterial, and virus will come under the biological agent. And the chemical, poison, alcohol, smoke, physical trauma, radiation and fire, and nutritional lack and excess. Lack means malnutrition, excess means obesity. So this epidemiological trait will describe the a person disability or disease or disorder. Okay, so host will come under the person, environmental is come under the person which type of environment he is facing. Agent is nothing but the items or the bacteria, viruses which produce the infection. So this is called epidemiological trait. So in the mainly epidemiological trait, we have the agent, host, and environment. So the next question is, what is the antidote for warfarin? Okay, so when we give the warfarin drug for overdose for the patient, so how we can reduce the overdosage of warfarin? That is nothing but antidote. So antidote is nothing but which works against the other drug. Okay, for example, if the patient have in the poison, so in that case we will give the atropine like that. So that is the antidote which reduce the poisoning effect of the drug. The options are heparin, vitamin D, vitamin K, and insulin. So which is the antidote for warfarin? The right answer is vitamin K. So when the person having the overdose of warfarin, we should give the vitamin K. And the next question is, lack of oxygen in the cells is known as. So when the person is having the lack of oxygen in the blood, okay, so what it will be known as? The options are apnea, hyperapnea, cyanosis, hypoxemia. So here you can see the palm of the woman, how it will be look like. So here we can see the a bluish discoloration of the fingertips. Okay, this is nothing but cyanosis. The right option is cyanosis. So when the lack of oxygen is present in the cells, okay, that is called cyanosis. So when the oxygen is lesser in the blood means that is hypoxemia. So the next question is, which of the following is used for the assessing pain? Okay, so which of the following is used for the assessing pain level in the children? So commonly in the adult, the patient will describe about the pain, how much of pain he is having, what type of pain, and how much duration of the pain he is suffering. So in the case of children, the children cannot be described about the pain. So how we can assess the pain in the children? The options are verbal descriptive scale, numerical scale, visual unlock scale, Wong-Baker face pain rating scale. So the right option is Wong-Baker face pain scale. So by using of this scale, we can assess the pain level in the children. So here you can see the pain rating scale. So here we can see the WhatsApp emojis. Okay, so in the WhatsApp also we are using this kind of emojis for the expression of our feelings to the others. So in the same way, by assessing the children's pain, we can match the what type of face the children is having. For example, the children is having no pain, smile face. Okay, so here the lips are widening very much, and second stage the lips are not wider. So like that, according to this scale, we can understand the pain level of the children's. So the next question is, the following are physical assessment except one. So we all know that the what is the physical assessment? Okay, physical examination. So which among these options which is not okay, except you always remember, you always look for the question. In the question whether it is except means you have to think negatively. Okay, the options are inspection, palpation, history collection, auscultation. So among these four options, the physical examination comes under the inspection, also come under the physical examination, palpation also come under the physical examination, auscultation also come under the physical examination. So which is not come under the physical examination? Only history collection. So history collection is not coming under the physical examination. So the right answer is history collection. So the next question is crackling sound at the base of the lungs. So when we are auscultating the lung function of the heart patient, so we hear that the crackling sound. Okay, crackling sound is present at the base of the lung. So what is known as? The options are raunchy, wheezing, rails, pleural rub. So the right option is rails. Okay, rails are nothing but a small clicking, bubbling, and rattling sound in the lungs. So when we are auscultating the lungs of the patient, so if we hear the a small clicking is nothing but cling cling, and bubbling are we can hear in the water when the bubbles are coming under the water, that is known as bubbling, and rattling sound in the lungs, those are called as the rails. So they are heard when a person breathes inhales. So when the person is taking the air into the lungs, so we will hear the rail sound. So they are believed to occur when the air opens closed air space. So when the patient is having the closed air space, so at the time when the air opens the spaces, okay, during that time, we will hear a small clicking and bubbling rattling sound that is known as rails. So the next question is, all of the following are manifestation of brain death except one. So here you have to underline in every question in the examination, you have to underline the question which is the basic one. So here I am underlining the except. So all of the following are manifestations. Manifestations are nothing but symptoms of the brain death except one. The options are diabetes insipidus, non-reactive pupil, no response to the pulse, and EEG delta waves. So based on which of the option we cannot say the person is on the brain death. The right option is EEG, electroencephalogram. By using of these delta waves, we can estimate the person is not on the brain death. The next question is, the end of the blood vessels are known as. So The blood vessels are starting from the aorta, thoracic aorta, abdominal aorta, and it will spread to the limbs, okay, organs, tissues, and cells. So, what is the end part, the last part of the blood vessels? Options are aorta, venous, capillaries, and venules. So, what is the right option? Capillaries. Capillaries are nothing but the dead end of the blood vessels. For example, when the vein comes from here and when the artery is come from here, at the joint, the artery and vein will be joined. Those are called capillaries. So, in the capillaries only, the oxygen and the nutrients will be exchange will be taking place. So the next question is, to prevent supine hypotension. Okay, to prevent supine hypotension, which position is preferred? So when the patient is having the supine hypotension, so as a nurse, which position you will be prefer? So which position you will advise for that patient? The options are lithotomy position, supine position, left roller position, Fowler's position. So you all know which position is used for the prevention of supine hypotension. The right option is left lateral position. So in the case of left lateral position, the supine hypotension can be prevented or reduced. Why? Because when the patient is on the supine position, the pressure will be present on the aorta, abdominal aorta, so it can cause for the supine hypotension. So to prevent that, we should advise the patient for left lateral position while sleeping. So the next question is, risk of cold chain failure is higher in. So you all know what is the cold chain. Cold chain is nothing but carrying of the vaccines. So in the case of cold chain failure, so where it will be higher? The options are regional level, district level, community health center, and sub center. The option is sub center. The correct option is the sub center. So in the sub center only, we will use cold chain, which carries the vaccines. The next question is, following are the content of accept. Sorry, this is wrong answer. We'll go for the next question. Which is the easy method for NG tube in situ? Situ is nothing but in the correct position. Okay, situ is nothing but correct position. So, which is a better way and easy method for NG tube in the position? The options are X-ray, auscultation, aspiration, all of the above. The correct option is auscultation. So, when the nasogastric tube is present in the stomach, when we exhale the inject the air into the NG tube, we can hear the bubbling sound in the stomach. So, which is the it is the easy method for the NG tube is in the correct position. And other question is, which is the specific method for NG tube in the correct position? That is X-ray. So by taking the X-ray and aspiration, so when we take the aspiration, we need to send for the lab whether it is the NG tube is in the correct position or not. Before that, we can use the X-ray method, which will give the specific confirmation for the NG tube in the correct position. So this is the end of the class. I hope you all understand, guys. Thank you.